So let's chat.
All right, how's your semester going so far?
It's not bad. I feel like being at Health Tracks has been a pretty big learning curve. Honestly, I've had like no rehab experience prior to this, just because at football you kind of got your hands wet. Just because we were second years when I was at football, and so I kind of feel like I was pushed away from the rehab side of things and more like, oh, DMS, this, that, whatever. And then being at track, it was more pain management, same thing. And then you are a kickapoo, so you know what that's like. That's more acute eval. And so this semester has been a really big learning curve for me in that aspect. And they also have a very specific style of rehab. So kind of learning rehab in general, plus this very specific style, has kind of set me back, but also pushed me forward at the same time, because I've had to step out of that comfort zone. And so that's basically what my goals were based on. So my first one, which is what my reflection was about, my first goal was I would like to improve my skills of delivering and teaching home exercise plans to patients going through rehabilitation, which when I first started was terrible. Candace would have me teach people. So, at the end of each rehab session, she'll say, okay, I want you to go home and do this, this, and this exercise until I see you next. And I think I had a really big issue with being very verbal with people rather than using like tactical cues and showing people things. Because when she'd be like, okay, teach someone how to belly breathe, I would use words. And I don't know how you are, but the average person is a visual or kinesthetic learner. And so it took me a really long time to not resort to words when teaching someone something, because people would kind of just give me a blank stare.
Sure.
So that was pretty hard at first, but now that I've gotten more comfortable with it and I know more of the movements and the postures and patterns, Candace will have me teach the patient their like homework for that week. And the first few times that I did it, I would kind of like look at her every time I said something for like approval. But now I do it fairly comfortably and confidently. And, there's always something I can improve, and she'll give me that tip afterwards, but it's not me looking at her every time I say a word like, okay, did I just say that right? And it seems like the patients are picking it up more easily with what I'm saying than at first. So, and, we kind of talked about that with my midterm eval, how I could definitely improve on that. So, but it took a little bit, but I got there.
Okay. How many of the same patients do you see?
Like in a week?
Yeah. Are they used to you by now?
Yeah, and so that's the thing, and that's also something I have to work on, is keeping, each patient individually, like, straight, because we have a lot of similar injuries, like, we have a lot of shoulders, and so she'll be like, okay, Tammy's coming in, and I'm like, you're gonna have to remind me who that is, because I remember faces and situations,
Sure.
But I'm not a name person, just because some of those people, oddly enough, like, I'll see them 1 week, and I don't see them for another 2 weeks, so I kind of have to refresh myself. And typically once she gets me going, I'm like, okay, I remember that. But, most of our patients right now come in twice a week. But it just depends on their schedule and mine. And I'm kind of spotty with classes. So there's a handful of them that are really used to me. And, like, especially the younger patients who aren't necessarily post-op, but just, like, some sort of, like, we had a swimmer. I think she's 15. And she has lower back pain, and she's very easy to work with. Like, she has really good motor control, things like that. So it's like a really good patient for me to work with. So those patients, Candace will let me be very hands-on with and plan the next exercise and things like that. So I'm way more involved in those sessions, so they're very used to me. But the ones where, like, we have a guy who's, like, very fresh post-op shoulder, and he's really, like, nervous and guarded. So Candace does more with him, just because, at a comfort level thing for him, I think it's better that she does more. And so there are definitely a handful of patients that are very comfortable with me, and I like that because it makes me feel more comfortable, just because, I don't know, I have a little bit of a hesitant attitude towards some of the patients, because I don't want them to feel like, oh, a student who doesn't know anything is working on me.
Right.
I
feel like that's more common in a setting where parents and insurance and whatnot are paying a lot of money for their kids or themselves to go to rehab. So they feel that they need the best care,
right?
By an actual certified technician.
Mm-hmm. Yeah, and I was talking to Candace about the other day. She'll ask me a question in front of a patient, and I always hesitate because I'm like, I don't want to sound stupid. But you also have to remember, they have for the most part, they have no idea what we're talking about typically, unless they're, we do work with some people who work for Mercy and understand more of that. But a handful of the time, she's like, well, one, I know I'm putting you on the spot, so you're not going to be able to answer right away. And two, she's like, they have no idea what we're talking about. So that's not something to worry about. But I do, like, like I said, there's a group of her patients that I'm pretty close with. And, you know, I've gotten more used to, and I know that their situations very well. And so that works both ways. It's good for them because they trust me, and it's good for me because I feel more confident in what I'm doing.
Sure.
And she said that I'm typically pretty good at building that rapport with patients and, you know, getting them to trust me. And that's something I like to work on. Even if I don't get to be hands-on, I try to establish it verbally and, you know, make them feel comfortable, especially if she's, like, doing something painful. I kind of try to distract them and talk to them, so.
That was one of my goals, too. That's my third goal.
Yeah.
But we can get to that when we get there. So.
All right.
How many, like, home exercises do you usually give? Do you give them to them every appointment? Like,
yeah, typically. Yeah, because, I mean, unless a patient isn't progressing, which isn't that common, we might have them do the same exercises for that week. But typically every appointment, she'll pick, you know, like, I would say somewhere from 2 to 3 exercises that were more difficult for them, or that she saw the best results with. And so I know, like, typically she'll say, okay, do this, and this exercise, and kind of remind them. But with our younger patients, and we actually had an 11-year-old yesterday, they don't, like, remember that well. So sometimes we'll even take videos of us doing it for them, and we'll, like, talk over the video so they can take it home with them. And we'll, especially, like, if their parents are there, we'll put it on their phone, and their parents can kind of help them do stuff at home.
Okay.
So just because, you know, it's hard if you're doing a 30-minute session with someone, you make great progress, and then they don't do anything at home, and they come back, and they're like, I don't remember what we did.
Right.
You're just backtracking. So we try to make sure that they are 100% set up for success. So we'll send them home with lacrosse balls, send them home with anything, really. And, like, we always touch on 3 exercises and then some sort of manual therapy. So we'll give them lacrosse balls and say, okay, and, like, we don't say, you know, roll out your lat. We'll be like, okay, put the ball here. You know, we'll, like, show them and have them feel for a spot and make sure that they know how to do that before going home. So, yeah, they're pretty much set to make sure that even though they're only coming twice a week, they're still progressing at a great speed. So, yeah.
So what's your favorite, like, patient you've had so far? Like, what have they had for an injury treatment that you're trying to work with?
I don't necessarily want to say it's been my favorite because it was really challenging, but we've had a lot of bicep tendinosis and just, I mean, in general, shoulder patients. Post-op for me has been my favorite because, I mean, I don't know about you, but upper body, shoulder was something that I really struggled with. There's a lot involved in there, and it's the joint itself is so unique compared to the rest of the body. And so at first I was kind of like, okay, this sucks because I know nothing. But I honestly, you know, in retrospect, really appreciate it because it truly pushed me out of my comfort zone. I kind of, you know, and it was one of those things where she'd be like, okay, do some soft tissue work on their shoulder. And I'm like, I don't even know the anatomy of the shoulder that well. And so that was also something that I kind of grew my confidence in, was just that anatomy in general, but being more intentional with soft tissue work and things like that and knowing where I'm at and what I'm doing and why. And that's also something I've been focusing on, is the why of why we're doing things. So whether that be soft tissue or exercises, I've been trying to ask Candace more questions because I feel like sometimes I go through the motions and I don't
understand why you're doing it.
Oh, yeah. And even I'll watch Candace do something and I'm like, okay. And then I think about it, I'm like, okay, well, do I really know why she picked that instead of this? And so sometimes she'll see me kind of like tilting my head and like looking, she's like, what are you thinking? And I'm like, I have no idea what you're like, I'm lost, you know? And so she's really good about asking me questions or talking me through what's going on because she knows that, like, that's something I'm trying to work on.
Do you do that, like, with the patient there, too? Like, when you ask her?
It kind of depends on the question.
Wait until afterwards?
It depends. So if it's something that, like, it just depends on the question because I don't ever want to seem like I'm challenging her in front of a patient.
No,
we talked about this before. Because sometimes I'll be like, okay, well, why did you do this? But typically I won't ask, like, why did you do this instead of this in front of a patient? Because, like, I don't want them to think, like, oh, she's doing, and obviously she knows what she's doing and they know that, but I don't ever want to question, like, what she knows in front of a patient, even though, like, I don't mean it that way.
Sure.
So typically I will ask throughout, especially with, like, you know, when we're progressing through postures and patterns, because that's something you kind of have to track. But it just kind of depends on the question, I guess. And if it's something more lengthy or just like a general, not a specific one and more of just a general thing, I'll wait until after so we can get into like deeper conversation with it.
I was just curious on like the patient's reactions.
Yeah.
You know, if you ask them a question, if they looked at you more like.
Yeah.
You know, as a student, I mean, do they really want you working on them kind of thing?
Oh, right.
If they don't think you know what you're doing.
Yeah. And that's something I always, like, that's at the forefront of my mind. And, you know, just not stepping on toes and all that. It's, you know, and like me and Candace have a good relationship, but like I want to keep that line of respect. And, you know, I mean, at any site, no matter who you're working with, that's always something you want to pay attention to. And so I'm just very careful about what I ask and like what I answer and stuff like that. And sometimes they'll ask her a question and she'll say, well, what would you do? And she'll ask, like, she'll have them ask me, and then I'm like, typically I'm kind of like, oh shit, because
well, sure,
we'll put me on the spot, but you know, so but she'll, like, you know, sometimes they'll ask me questions sometimes, but they typically ask her questions. So, but
yeah. Okay. One of the big goals I set for myself this semester was working on my evaluation skills.
Mm-hmm.
Overall, like, before the semester started, I didn't feel that they were, like, too bad.
Mm-hmm.
Upper body, of course, with being the shoulder and some of the stuff in the back, it tends to be a little more challenging for me. You know, I think the scapular, like, humeral rhythm stuff.
Yeah.
Even after we talk about it in class, you know.
Yeah.
Because of the line of pulls and all that, it just really gets confusing.
Mm-hmm.
And, like, even if you know the mechanism of injury for some stuff, like, for me, it's hard to kind of, like, think about all that, especially when I'm trying to communicate with the patient.
Mm-hmm.
Because, like, I want to kind of, like, keep moving through the eval so that make it as smooth as possible from their point of view.
Right.
You know?
Mm-hmm.
Because I don't want them to think that, like, we don't know what we're doing.
Yeah, right.
You know? So it's kind of like, you got to find that happy medium, I guess.
Yeah.
But I've kind of come to figure out that the quality in the eval is, in my opinion, better than the quantity.
Oh, 100%.
You know,
mm-hmm.
I get, and I understand from their aspect that they'd like to get back to practice if it's nothing major, you know. But we have to find out whether or not it is something major. So really, it's more important to take the time to do the eval and try to be as accurate as possible.
Yeah.
The things I don't like when I'm doing an eval, and I've had this happen, is when my preceptor challenges me in the middle of it.
Yep.
Because of, you know, view.
Mm-hmm.
And I actually had an episode where I was doing an eval on a knee, which this was one of my reflection logs, but lower body, I feel really comfortable. Just in general.
It's much simpler.
It is. And I had a lot of experience with the knee myself.
Right.
So,
yes,
like,
you did.
I know quite a bit about the knee.
Mm-hmm.
I thought. Which, when it's a basic thing, you know, like an MCL, ACL, LCL, all that good stuff.
That's pretty easy.
Like, it's pretty easy to diagnose. Mm-hmm. But when you get into more of the patellar tracking stuff, or like patellar tendons, for like example, this student showed pretty much every single sign for like an ACL and like medial meniscus issues.
Right.
The mechanism didn't add up to an ACL.
Mm-hmm.
I mean, there's a little bit of one because of the shifting of the weight and like the anterior displacement of the tibia.
Yeah.
And all that stuff. But whenever I asked him what he did, he acted like he jumped to shoot. It was a basketball player, jump and shoot a hoop, and then he landed on it like a single leg and kind of like hyperextended and then like shifted forward.
Right. Okay.
And so I was like, well. And then he talks to Bert after I get done with my eval, right? Because I told him what I thought. And I think John, which was the GA in my side, was on the same page with me. But he was so guarded that it was so hard to actually get a good, you know, Lockman's test and all these things. Anterior drawer was hard. He actually kind of showed more like symptoms with PCL, with posterior drawer.
Yeah.
But she was kind of on the same page. Which she's always been really good to me about saying, like, don't be 100% certain in your diagnosis.
Yeah.
You know, keep it kind of general. Which I kind of struggle with at times.
Me too.
Because it's like, if you have, my thing is like if I have 5 signs, like 5 special tests that add up to pointing in one thing,
you're gonna want to point at.
And like if the range of motion, functional, and all that stuff goes there, it's like why wouldn't it be?
Right.
So if I get signs showing one focus place, a lot of times I'll do a test. If like just going through palpations and history, mechanism of injury, and all that stuff, usually you can get a pretty good idea.
Yeah.
What you think the injury is, and so then when you get to your special test and they meet what you thought it was, it kind of adds up. So then you do multiple of those, and then you got multiple special tests that are positive. That's what you think it is, but in this case it wasn't. So then it makes me question the special test and the validity.
Yeah.
And anyways, Bert looks at the kid, talks to the kid for about 30 seconds, and has what he thinks it is. But the kid said a completely different mechanism of injury this time than what I got.
Yeah.
So it was kind of hard because he said he was stationary, and he took like a 90 and opened up his hip, and then took a shift. I can't remember what the move was called, but it ended up being that his patellar tendon kind of like moved medially when he shifted over, and it went over the fat pad. So he basically just had a bunch of fat pad irritation because of his patellar tendon. And Bert like questioned me right in front of this athlete as to like the mechanism or like what I thought it might be after that, which is what I'd said that it was probably fat pad irritation, and then he just kind of gave me that one of those, like I got it, but it would make me feel better, after the fact that I got it after I heard the new mechanism of injury.
Yeah.
But initially, like I was really like upset. With myself because he figured it out so quickly. But it also wasn't necessarily fair that I didn't get the same, initial information as he did. So, not saying I would have got it that quickly.
Right, but...
Because that's just not necessarily a typical thing.
Well...
I haven't really worked with basketball a lot.
Oh, yeah, neither.
Or sports that shift the whole time. Football you do some, but it was just something different. I mean, it's not like an injury in class either that we really just talk about, like in lower body.
Yeah.
Like, it's simple, like it makes sense, but it's not like one of those things that we really just focus on like an ACL tear. So it's not where my head was initially going,
Yeah. Well, but I kind of had a conversation with Karen and Candace about this the other day about how you pretty much never have a patient walk through the door that's textbook. She was like, she said something like textbooks are a fairy tale or something like that, like a fairy tale reality. Like, you're not going to have those textbook patients, and I think that's something I struggled with in eval because it's like, okay, this, and this matched up, and according to the textbook, that would be this. But like you said, like it's not always going to work out like that, and I think that when you're evaling a patient, one, you have to be willing to make mistakes, which, I mean, that's going to happen all the time, and that's why we have a preceptor watching over us. But then from the other end, your preceptor has to understand that you are going to make mistakes, and those are the learning opportunities, but those are the times they should be building you up and working with you and saying, okay, like I see where you're coming from, but maybe look at this, you know what I mean? Right. And so, and that's the thing, like all of us, and I know, like, I don't want to speak for you, but I'm guessing, like, we all would probably say we need to improve our confidence. And that comes with making mistakes and in those moments being built up from it. And, I mean, obviously, like, constructive criticism should always be there, but they should also be building you up because that's that foundation that we need right now going into this stuff and moving forward, because as we continue doing these things, like if we're constantly being beat down every time we make a mistake, it's like you're not going to want to do things. It's not building
our self-confidence at all.
Yeah, and like we talked about earlier, like being questioned in front of a patient when we're already worried about how a patient views us because they know that we're a student and we're not certified, we don't know as much, things like that. I mean, that's like, it beats down your confidence. Yeah, it's like, it's a mental thing, and you're thinking, because then I know I'm sitting there thinking, okay, so like, what are they thinking about me right now? Like, do they trust me? You know what I mean?
That was another thing that was hard about that situation, and I think that's one reason I got upset.
Oh, yeah.
Because the athlete kind of laughed at me.
Yeah.
After Bert figured it out so quickly.
And that's a crappy feeling.
So, right. I don't know. Kickapoo tends to have some more like snottier kids, it seems like, compared to some schools. But yeah, I don't know. It was kind of rough.
And I think especially like when you're working with a younger kid like that, I don't know. There's not really a specific population to me that feels easier to work with because, you know, there's different qualities in each that makes me like a little uneasy about working with them. Like younger kids, like they think like, oh, I'm older than them, blah, blah, blah. Like I should know these things, whatever. And then when I look stupid, they're like, oh, well, she doesn't know anything. But then it's kind of like a double-edged sword. If you're working with the older population, they're like, okay, well, she doesn't. Like they assume I don't really know anything, you know? And then I'm like, okay, well, now I need to prove myself. So
yeah,
it's just hard. But yeah, I mean, I always kind of got that with the high school setting and working with Bert specifically. I did have those issues sometimes. And, you know, I kind of took everything with a grain of salt. Like that's just how he is. So I tried not to take it personally. But there were times where he would question what I was doing in front of them. And I understand, you know, if you, let's say you're evaluating a patient, you're going down the completely wrong road. I understand him stepping in and maybe leading you, but don't question you. That's something you should discuss later on.
Exactly.
For your sake.
Right. Because I feel like you'd have a lot more productive conversation later after your eval than right in the middle of it.
Yeah, no, and this kid's sitting here waiting too.
Yeah, the kid doesn't need to sit there and wait for that, you know. I mean, granted, it might take you longer to do the eval if you're going in the wrong direction. Like, I know before, I mean, most of the time I'll do the eval and he'll be okay with what I say. Yeah. You know, like, he'll kind of roll with it, but there's times, like, I've seen him kind of do his own after we're done.
Yeah.
But another thing I feel like with him is, like, I don't feel like his criticism is real constructive in the way he presents it.
Yeah,
so it's kind of hard to take a lot from it, you know. But he's extremely smart.
Oh yeah, Bert knows.
He's an excellent athletic trainer.
100%.
Which makes me want to learn from him, you know.
Yeah.
Like I want to take what he says, but it's hard for me to like get it all the time. I guess because he doesn't present it the best.
And I mean, there's a difference between you could be an amazing athletic trainer, but struggle to teach someone how to do these things and work with them, and those are two completely different.
And that's not what they sign up for.
Oh no,
you know, I mean, they don't have.
He just ended up in a location where it's just teaching.
Like that's what they
do.
Yeah. But I feel like it's kind of hard though to be in anywhere now to where you don't have to do that with students.
Well, I think I got lucky this semester being with Candace, just because, and I've been working with Karen too, just a little bit off and on, and that was one of my major goals was working on being a little bit more vulnerable and being okay with making mistakes because I beat on myself when I make stupid mistakes, but like that's what we're here for. And I talked to, I mean, yeah, this is the time to, you know, Carr gave us a lecture once. He's like, this is the time to make mistakes. Like, I mean, put yourself out there. I mean, don't be stupid.
Preceptors need to realize that too.
Yeah,
you know,
and that's the
I
thing.
don't feel like he does a whole lot. Yeah, necessarily. You know.
Yeah.
I feel like he expects us to be perfect because we are learning everything right now.
Yeah, but it's also new to us.
But it is. It's new, and like I don't know about you, but like last semester, I was with Missouri State softball. They rarely ever got any injuries.
Oh yeah.
Right. We had one girl one time that her cleat stuck when she was running bases. She went to slide, and one of her cleats like stayed in the ground and it didn't come out. So she hurt her knee. Well, we looked at it, and we thought it was an ACL. My preceptor on the field didn't do a lock wins at all when she first got out there. She knew it was a knee thing, and that was one of the first things we talked about.
Yeah, Carr always says just
do the lock wins. And I asked her when we got done with the eval later. I didn't want to do it in front of the athlete,
right?
Of course,
exactly.
But I asked her later why she didn't do lock wins initially, and she didn't really have a good reason.
Yeah.
So. But it ended up being a bone bruise on the femur. But it presented a lot like an ACL. So another non-textbook kind of injury, you know.
Right.
But that was like the only thing we really had all semester.
Yeah.
We had a girl that had a prior, like a surgery on her tendon in her ankle that we worked with on rehab some.
Yeah.
But with class schedule, most days she had already had her rehab and AMR, you know, or they were wrapping it up when I got over there. There were a few times I got to do some exercises with her.
Yeah.
And we still didn't know a ton about rehab yet. You know,
Yeah, that's how I was at track.
And I applied it.
Yeah.
What I could. But.
Yeah, that's how I was. That's the same for me at track. You know, it was all pain management. I would miss rehab sessions, and Joel was introducing me to the functional lines and things like that, so I was kind of getting a taste of it. But this is the first semester where I can personally say that, like, I'm actually being challenged, which kind of, like, I've loved my past clinical settings, and I think the high school challenged me a little bit, but in a different way, just because I hadn't had that much eval experience. So that was cool. But like rehab, I mean, we do evals, we do soft tissue, we do exercises, like you get the whole shebang, you know, for lack of a better term. And so that's why, you know, I don't necessarily love the clinic setting, but I love the experience that I'm getting there. And I really, really like working one-on-one with patients and, like, getting to see, you know, because I'm seeing, like, we had a patient where I literally watched, like, the eval through the however many weeks of rehab that she did. And so I think that's really good for me to kind of see that progression, just because I haven't had a chance to do that yet. And Candace, you know, has been really good with me, like, asking me questions and making me, kind of putting me on the spot, because I'm not good with that either. And so, I don't know, I think, like, I've gotten a lot better with, you know, thinking more in simple terms, and, I don't know, just being better with my confidence in general and whatever. Being cool with all that. Just making mistakes, honestly, has been my big thing, so.
Yeah. Just like, well, semester before last, I was at spring football, Missouri State football.
Yeah.
You know, I didn't get a whole lot of eval experience there, because they always want to do the evals, because the coaches, I'm sure, like, you know, certified athletic trainers have to touch the athletes first, because that's how they are. So I didn't get much eval experience there. I didn't get a whole lot with softball. So, like, this semester is like,
you're getting it all.
This is more my eval time. I think it would have been really cool to be at Health Tracks this semester.
Yeah.
With the classes that we have, I think it'd be really good to be able to, like, apply that kind of stuff more.
It has worked very well.
Bert doesn't do rehab at Kickapoo. I did try to do some rehab with that athlete at the beginning of the semester, and I thought it went well for the one time we got to do it.
Yeah, he keeps it pretty simple, and he has a very big rule about, like, if I do this for one athlete, then I have to do it for everybody else.
Right. And
being at a high school, you have limited resources, and you have hundreds and hundreds and hundreds of kids coming in. So I get that, but that was what I always wish, is we did a little bit more rehab, because I was like, okay, it'd be nice to get a taste of it before being exposed to it 24/7. But
Health Tracks, right? And so that was another one of my goals, was to try to work on my rehab skills this semester before I get to Health Tracks.
But
where, you know, where it's going to be a lot harder, because I'm not great with coming up on stuff.
Oh yeah, me
on
neither.
The spot, you know, and. I mean, I don't know. This was one thing I was going to talk to you about, was, you know, like, Jim Rainer. Because I know, like, I've taught in the past, and I've seen it.
Yeah.
He'll go up to kids at Health Tracks and be like, why are you doing this? You know, like, and then he'll just keep asking why. And I really want to be able to explain everything and have a reason.
Yeah.
Because, like, you're talking about having a reason for what you're doing.
Oh, yeah.
And I talked to Colton about it, and he acted like he hadn't really talked to him a whole lot.
Yeah.
He doesn't really act like he comes around, but
he'll pop in. But I haven't had any experience like that yet, where he's come up to me and been like, "Why are you doing that?"
See, that's one thing I'm scared about, is that he will, especially being a fourth year, because, like, I'll be a fourth year, so it's
he's like, he expects it
a little bit harder, or higher up, I guess. So then it'll be more like, well, you should know all this stuff by now.
Yeah.
But if I haven't had a chance to apply it, which I didn't really get a chance to apply much with softball,
right?
I did some rehab stuff. It was more of like corrections, and soft tissue work with football.
Right.
With DMS and all that stuff. But again, I was a second year in the springtime before that. No rehab classes.
Oh, no, yeah, much
Everything
of anything.
I was doing was stuff that they
the
told
basics.
me to do. You know.
Well, and, you know, I think that was something that I worried about too. Jim, I've gotten to know Jim better, and he doesn't intimidate me as much, but he is someone that I do look out for, and I'm like, okay, like, gotta be on my A game for sure. But, and like I said, that's why, you know, Candace, so she'll be like, okay, I want you to come up with the next exercise. I'm like, okay. And when I'm sitting there, I'll be like, oh, I don't know what I want to do. And she's like, well, what are your intentions? And I'm like, honestly, I have no idea. Like, I think that's why I can't come. So, like, she's good about, like, or especially if I pick something, she's like, okay, are you just picking something, or do you have a reason? You know, and so, and sometimes she'll kind of catch me, and I'm like, I think I just picked something. So I'm like, oh, that sounds good. And so I think, and I told her at my midterm eval, I'm like, I want you to keep asking me those questions, because that's something, like, I know personally, like, I will literally be sitting in my head and I'm like, I have no idea why I just told this person to do this. You know what I mean? So, and that's why I've also started asking her, I'm like, okay, why are you doing this? So that way I just need to be more comfortable with, you know, the reasoning behind different things. And, you know, I know the postures, I know the patterns, but then it's like, okay, why did you pick this specific one?
Sure.
So I think that's just something that when you're there, you know, just ask those questions and don't be afraid to. I ask Candace like a bajillion questions a day. But it's honestly helped me out a lot because I felt like, honestly, in the past, I didn't really ask questions, and that's what we should be doing.
Sure.
So it's just something I do try to keep in mind, like, the entire time I'm there. But yeah, so I think for me, it's just, you know, continue making those mistakes and honestly improving my interactions with patients, not necessarily just conversation and whatnot, but, you know, making sure I can teach someone something and not necessarily just do it. And then asking questions and knowing what my intentions are, because I think a lot of things I was doing in the past was without any intention at all. I think I just kind of was going through the motions or doing what someone else told me.
Sure.
So
a lot of times you're not going to get an athlete that'll ask you why you're doing something.
Mm-hmm.
I feel like just from personal experience, but occasionally you'll have your, you know, somebody in the health field
mm-hmm.
and they want to know a little bit more.
Yeah.
You know.
And that's something you have to just be ready for.
And I don't know necessarily why. I don't know if it's because they think it's interesting or, you know, if they're like, we're a growing profession, so they want to like test our knowledge if we're wanting to be like a healthcare profession.
Oh, yeah.
Kind of thing, you know? I don't know how much it is, but
yeah,
it is one thing I noticed.
Yeah.
So, well, it sounds like you like Candace.
I do like Candace. She's awesome.
That's good.
Took a minute to get comfortable, I mean, with any preceptor, but
sure.
now I'm like way more. That's why I said, like, I'm asking more questions now, just because we just have more of a system, and I know how she works, she knows how I work, so, you know, just being upfront with them and asking those questions and getting comfortable, just kind of diving in, honestly, is the biggest thing, but I really like her. She's taught me way more than I've learned in my other sites, so that's for sure. But yeah.
Sounds like you're having a pretty good semester so far.
It's not bad.
Good deal.
Well,
good talk.
That was a great talk.
Yep.